So good morning students. I am Lily madam. So continuation of 14th unit, that is meeting special needs of the patient. So I am going to continue the third subtopic of the unit. Okay, so that is urinary elimination. So what are the abnormalities of the urinary elimination? That is retention and the incontinence. Okay, so urine retention as well as the urine incontinence. So first we'll be dealing with the what do you mean by urinary elimination. Okay, so what do you mean by urinary elimination? Nothing else but, so whatever the waste product or waste material is there in our body, so that is going to be excreted from our body is called as a urinary elimination. So that is only defined as expulsion of waste product and from our body through the urinary system. So that is called as a urinary elimination. So why elimination is very important means, and whatever the waste product so which is gathered in our body, so that has to be supposed to be eliminated from our body. So if it is not eliminating, so there are so many complications are going to be there, and this urinary elimination is going to be very essential part so for the physical well-being of the human body. So that is just the introduction regarding of the urinary elimination. And coming to the next one, so what are the causes and to make the urinary elimination, that is urinary retention and as well as urinary incontinence. So first one is a lifestyle changes. So lifestyle changes, mostly you see that in the busy schedule of your thing, so the person is not going to avoid the urine, or the person is he is not going to avoid the urine. Automatically the waste product is going to be stays in the body itself, and he is having a more chances of infection. And one more lifestyle changes like diet. Okay, so the way the diet you are following, so that makes the urinary system to be damaged. So that is also one of the cause for the lifestyle changes. And next one is a fluid and food intake. So already I explained that, and if improper intake of water is also one of the cause of urinary retentions. Okay, and next one is the food intake. The diet pattern is also essential for the causing of urinary retention and the urinary incontinence. And next one is the environment. So this third one is the environment. So environment means what means, so especially the person who is working in occupational setups. Okay, so or in a population areas, wherever you are going, and in the environment, so it is going to be releases some of the inorganic or arsenic chemicals or the acids. So these acids will makes you the urinary elimination abnormalities. And the fourth one is the psychological factors. So psychological factors, for example, like stress, fear, anxiety. So this is also one of the cause for the urinary incontinence and the retention. So for example, I'll say that, and if you have any exams, okay, so public exams, so your bladder will not be in a control, so you'll be having a frequent maturation, so okay, frequent urination feeling you will feel. So that is going to be there in a process of fear, stress, or etc. factors of the psychological factors. Okay, so some of the medications also responsible for the urinary incontinence. And next one is a muscle tone and activity. So muscle tone and activity, nothing else but especially so the parasympathetic nerve, which is responsible for the sphincter opening and the closing. So if that muscle is abnormal control of the sphincter, so that is also the activity of bladder control is also going to be irregular. And next one is a pathological condition. So pathological conditions like fever, diabetes mellitus, and you see that in fever you may see that dehydration will be there, and in diabetes mellitus the polyuria will be there. So these type of etc. pathological conditions also lead to the urinary elimination abnormalities. And some of the surgical and the diagnostic procedures. So the surgical and diagnostic procedures means, and the person undergo any type of pelvic surgery. So these are also some of the examples for the causes of urinary elimination and the urinary retention and the urinary incontinences. Okay, and next one is alterations in urinary elimination. So this is just what are the if any in urinary elimination, any alterations are happening. So the two conditions we have learned, that is urinary retention and urinary incontinence. So not only that two, if any abnormalities are there in a urinary elimination, so that may lead to the, so these following signs and symptoms. Okay, first one is a polyuria. So polyuria means what? Excess of urine passage from your urinary tract. Okay, so urinary tract means mostly, so within 24 hours of 24 hours of the day, so the person is going to be urinate 2.5 liters to 3 liters of urine, the person is going to be urinate from the body. Okay, so that much of urine is called as a polyuria. And next one is a oliguria. Okay, so oliguria is nothing else but, so the person is not having a urination. Okay, so the person will not avoid the urination. So how much of urine he is going to be urinate per day means 500 ml of urine. Okay, so that is called as a oliguria. And next one is a anuria. So anuria means failure of a kidney to produce a urine. Okay, so anuria means what? Failure of kidney to produce urine. So nothing else but it is also called as absence of urine. If kidney is not giving a production of waste product of urine, and there is no passage of urine is going to be there, so that is called as what? Anuria. And next one is a nocturia. Okay, so next one is what? Nocturia. So nocturia means what? In especially in the night times, so the person is going to be urinate continuously. Okay, so continuously frequent nighttime urination will be more, so that is called as nocturia. Okay, frequent nighttime urination, that is called as nocturia. And next one is a dysuria. Okay, so dysuria means nothing else but difficulty urine. Okay, so dysuria means difficulty urine, and while urinating, so the person will feel a pain over the lower abdomen. Okay, so dysuria means and difficulty in urine, and while urinating the person will feel that pain at the lower abdominal area. Okay, and next one is a enuresis. Okay, and the last one is enuresis. So enuresis means and a repeated inability to control the urination. So the person is continuously repeatedly feel to urinate. Okay, so repeated feel to urinate. Okay, so that is called as what? Enuresis. Okay, and next one is a hesitance. So hesitance means what? Means, so that is a tentative behavior. So okay, the person will have the hesitance to pass a urine. And next one is a urinary incontinence. Okay, so that we will deal in detail regarding this condition. So just I will deal what is the meaning of the urinary incontinence. So urinary incontinence means what? Means involuntary leakage of the urine. So what is urinary incontinence? Involuntary leakage of urine. Okay, so before voiding of urine only, so the person is going to be void the urine by drop or continuous flow of the urination is going to be there in a urinary incontinence. And next one is a urinary retention. So urinary retention means, so inability to empty the bladder. Okay, so what is urinary retention? Inability to empty the bladder. So how much you want to empty the bladder, and the remaining so flow of urine is going to be stays or remains within the bladder itself. Okay, that is called as urinary retention. Okay, so that is what are the alterations in the urinary elimination. Okay, so first we'll be seeing, so in the condition we are going to deal, first one is what? Urinary elimination. So the two types of urinary eliminations abnormalities are what? Urinary retention and urinary incontinence. So first we'll be dealing with the urinary retention. So urinary retention means, already I explained you that inability to empty the bladder. So if the person is going to be urinate and after that also, so the remaining of urine is going to be stays within the bladder itself, so that is called as urinary urinary retention. So mostly you can see that especially in males, these are type of disorders only you are going to see this type of urinary retention. So causes already we have discussed, and some of the causes like obstruction of the urinary tract. Okay, if there is a enlarged prostate, or if you see any stones over the area of the prostate area, so you may see the remaining retention of the urine in the bladder itself, or infection that can swelling area is there. And nerve problem means especially the parasympathetic nerve, which is responsible for the sphincter opening and closing. Okay, so that nerve responsibility. And some of the medications and the constipation also, the person will not able to urinate. And urethral strictures or the weak bladder is there. Okay, if weak bladder is there, automatically so the bladder will not have the force to close the sphincter and open the sphincter, and whatever the urine is there in the bladder and full, it is not going to be urinate out. Okay, so that is a causes of urinary retention. So what is the symptoms means severe discomfort will be there, and already I explained you the pain in the lower abdomen is more, and bloated lower belly. So whenever you want to urinate, if you are so stopping that urine, so you will feel that the full belly is filled, so that is called as a bloating. And weak flow of the urine will be there and needing to go frequently. So you may see that if any urine is there in the bladder, and you will feel that and you have to urinate frequently, that is common. And feeling you still after you have finished. Okay, sorry, filling you still after you have finished. So after urination also, so the person will feel that and something is filled in the bladder, so because the urine is not voiding more. Okay, so that is the symptoms of the urinary retention. So what is the diagnostics you have to go for? There is a urine sample they have to take, and next one is a bladder scan you have to take if any abnormalities are there, and third one is a cystoscopy. So what is the need for the cystoscopy means, and scopy means already you know the visualization. Okay, scopy means visualization, so visualization of the bladder. So what is this cystoscopy means is the cystoscopy is going to be so visualize over the bladder area, and where the remaining urine is going to be evacuate out from the bladder surface. Okay, so that is examination. That urine is they are going to examine it if they have any infections or any kind of the urinary problems. Okay, that is called as a cystoscopy. And x-ray they are going to done if any abnormality of the bladder problems, or CT scan, and the blood test for the PSA. Okay, so here the PSA nothing else but so mostly prostate specific antigen. So PSA means what? Prostate specific antigen. So what is going to be there? So in the person who are having a prostate abnormalities, and they are going to so find out the infection over the blood. And next one is a urodynamic. So euro means urine, dynamic means visualization. So it is this urodynamic is also same like a cystoscopy, but slight difference that. And these they will enter the cystoscopy into the bladder, and so they will so check out whatever the problems are there behind the bladder or the sphincter or any nerve defect. So they are going to so differentiate what kind of disorders is there, and after visualization, and they are remove the urine from the bladder, and they will check what are the abnormalities are there in the urine. Okay, and next one is a prostate fluid sample test. So prostate fluid sample test nothing else but how they are going to do this sample means so over the penis area, so they are going to do the massage over the area. So at that pressure, and the some sort of an urine is going to be comes out, and that urine is going to be collected, and they are going to check the abnormalities of the urine. So these are the diagnostic evaluations of the urinary retention. And what is the treatment you are going to give means catheterization is very important, because so at a time the person is not going to be empty the bladder, so drop by drop, so the person is going to be so empty the bladder, and treating the prostate enlargement. So how you can treat the prostate enlargement means so the drugs like alpha blockers. Okay, ALPHA BLOCKER, so alpha blockers, and the so one of the medication like so deuterosteroid, DUTASTERIDE. Okay, so deuterosteroid. So these are the drugs which was given for the prostate enlargement. And third one is a surgery. So one of the surgery which is most useful for this urinary retention is transurethral resection of the prostate. Okay, transurethral resection of prostate. TRANSURETHRAL. Transurethral resection. RESECTION. Resection of prostate. So nothing else but, and whatever you are going with the cystoscopy, they are going to visualize the prostate area and where the tip of the penis is going to make the correction in order to make a normal flow of the urine. So that is called as a transurethral resection of the prostate. And what is the surgical management means the bladder neck repair or a urethroplasty. So what they are going to do here means, already you knows that plasty means reconstruction. So okay, so they are going to plaster that, so they are going to reconstruct the urethra, okay, and the bladder, so which is having abnormality of the bladder and the urethral neck area. So they are going to make a repair in order to so have a splinter control over the to close and to open and to push towards the bladder or urinary output. So that is a surgery they are going to do. And next one is a suprapubic cystostomy. So suprapubic cystostomy nothing else but, already I have shown you that cystoscopy. So cystoscopy means visualization of the bladder. So ostomy means opening. Okay, ostomy means what? Opening. So here opening of the bladder. So by opening of the bladder they are going to so remove the remaining of the urine from the bladder, and where so they are going to do the correction surgically of the urinary infections, or it may be or any type of an urinary surgeries like splinter problems. Okay, so that they are going to check out. And next one is the nursing management. So what is the nursing management you are going to give is a so urine output. OP means output. Okay, so urine output you have to check how much of urine he has voided for 1 hourly once. Okay, observed oliguria and the anuria. Okay, already had seen the definition of oliguria. Oliguria means what? So less urine output, and urea means what? And absence of urine. And next one is a percussion for dull sound. Okay, so what is going to be there means if your percussion for dull sound means, and if your bladder is empty, so you may feel that sound of bladder is a so dull sound. Okay, and next one is a client experiences. You have to change whether the patient is having a pain or not. You have to identify and provide a privacy to the patient, and comfortable position you have to give to the patient. And next one, warm bath for perineum relaxation. So because at the lower abdomen the patient is having a pain, so you have to give a warm bath, and for the perineal area how to make and apply ice on the inner thighs, and relaxation therapy you have to give, and catheterization you have to provide, and prevent the infection by giving some of the antibiotics, and maintain so close drainage you have to maintain, and avoid black flow of the urine, and avoid and maintain patency of catheter. So patency of catheter means so when the catheter has been kept and when it has to be removed, it is very important. And encourage increased fluid intake is important, and prophylactic antibiotics are very important if the patient is having the infection. Okay, and that is regarding of urinary retentions. And next one is a urinary incontinence. Okay, so next one is urinary incontinence. So you already had discussed the definition. What do you mean by urinary incontinence means? Involuntary leakage of urine. Okay, so what is mean by is that here unintentional or uncontrolled urine leakage that occurs due to poor functioning of the muscle. So already I said that. So what is a parasympathetic nerve muscles? Okay, called as urinary sphincter, enable to hold the urine in the bladder. So that muscle is the sphincter, which is helpful for the opening and closing, and that enable to hold the urine in the bladder. So that introduction regarding of unintentional urinary incontinence. So what is the types of incontinence means? Stress incontinence. Okay, so if the person is having the stress only, so already I explained the given example that during examination period. And urge to urine means the person will feel that urgency in urination. And overflow of incontinence means so especially so the person who will having a overflow, So drinking excess of water and due to the weather external factors, so that makes the overflow incontinence. And total incontinence nothing else but, so due to some of the other reasons other than the stress, urge and overflow, so the person will feel to incontinence of the urine. And next one is the causes and overactive of the bladder. So overactive of the bladder means, and if the nerve which is responsible is having a frequent force over the bladder, that is also one of the problem. And mental health problems like stress, fear, anxiety, so that is also responsible for the cause. Already we had discussed in the causes. And poor muscle control. So poor muscle control means the sphincter, the parasympathetic nerve, and which is responsible for the sphincter opening and the closing, so that is also one of the cause. And medication and prostate problems like swelling, okay, and excessive urine production is there. And the if excessive urine production is there by the kidney, and automatically overflow of the urine also is going to be there. And next one is secondary cause, that is medical conditions, okay, like for example any kidney problems is there, so automatically there is also one of the cause of urinary incontinence, okay. And next one is a treatment. So treatment whatever you are going to give here means lifestyle changes. So already in the lifestyle changes I have given you example that voiding of urine, so you have to so maintain the time regulators, okay. So hourly giving a intervals period, so when you have to void a urine, so that you have to set up a time. And the next one is a bladder training exercises. So I'll be explaining you what are the bladder training explaining. And some medications we have to give, and coping strategies like diapers also you have to ask the patient to wear incontinence of urine. So management what you are going to plan here means drink fluids in moderation, because overflow of urination is more here, so you have to drink a more water. And next one is a empty bladder completely, so you should not so giving a time to empty the bladder, so that is interval time you have to give. And we have to lose the weight is very very important, and avoid coffee or tea, and that will stimulate the sphincter more in the seasons, okay. And stop the alcohol and treat digestive problems. And what are the already had discussed exercises, okay, that is pelvic floor exercises. So what is a pelvic floor exercises means, and these pelvic floor exercises and will help you and to control how to control the incontinence of urine incontinence, okay. So that is a position of the, these are the positions and how to control the pelvic floor area. And over the pelvic area you have to, whenever the urinary flow is there, and you have to so control your pelvic muscle for 5 seconds, okay. And bladder training you have to give, and medications also you have to give to the patient. And next one is a percutaneous tibial nerve stimulation. So percutaneous tibial nerve stimulation means, so here you have seen that, yes, so the nerve is the yellow color passage, okay, that is connected with the pelvic bladder. Yes, so what is going to be there here means, so you are going to keep electrodes over this tibial nerve. So it is a electrical stimulator. See, this one is electrical stimulator, and these are all the electrodes, and it is a tibial nerve, and it is a bladder. So whenever you are having a electrical stimulator, and this tibial nerve is going to be stimulate your bladder to control the urination. So that is regarding of the so treatment and management regarding of the urinary retention, okay. So I hope you have understand everything. So